morning, everybody. This is Dr. Kurt Wohler. I appreciate you joining me tonight for another webinar hosted by Great Plains Lab. Tonight, we're going to shift topics a little bit. I'm not going to be solely talking about things related to autism, but we're going to kind of expand the list. In this particular talk, I just want to give an overview of what some of the different lab testing is, how it's used, where it's applied. And then, if you're an individual looking to do testing on yourself, your child, or if you're a practitioner, I think you'll find this presentation helpful to say, what are some labs that I could use for a particular patient who presents with a specific problem, or maybe they're coming in with a specific diagnosis already. So the title is Which Lab Testing is Recommended for Which Condition? All right. So I'm going to provide some information on what we're going to call integrative medicine lab test for a variety of disorders. We're going to really focus just on integrative medicine, and that makes up the category of what we call biomedical testing or functional medicine testing. And we'll touch on things like saliva testing, hair, urine, and certain blood tests. I'm not going to get into a specific thing, let's say, for a particular disease like lupus, for example, where you might do some really obscure immune system tests to try to confirm the diagnosis, which would be handled more by a rheumatologist. This is more a functional medicine, integrative medicine discussion, where we're looking for known things that can cause the immune system to be triggered, or metabolic imbalances, nutritional imbalances that might cause or contribute to a particular type of disorder. So with that, let's go ahead and talk about some common integrative medicine tests, what they are and how they're used. So the first thing I want to introduce, and we'll touch more on this here shortly, is the organic acid test. And if you're familiar with Great Plains Laboratory, you're familiar with organic acid testing, which is really their go-to test for a wide variety of different problems, because the organic acid test is really the cornerstone of biomedical testing from my standpoint, because it's looking at so many different factors that go on in the body. So it looks at yeast toxins and bacterial toxins, a very important marker called, two markers for Clostridia bacteria, which I'll talk about shortly. It has a marker for oxalates, which cause a corrosive toxicity in the body. Mitochondrial function, there's sections for nutrient analysis and fatty acid metabolism. So I'm hard-pressed actually to find a particular disease condition or some type of symptomatology that someone might come into my office with where the OAT wouldn't apply as a test. So I think it's an important test. And I often tell parents with kids on the autism spectrum is, if you're trying to figure out which test to do, should I do the organic acid test or should I do a comprehensive digestive stool analysis, my general statement is do the OAT test first, because you're going to many times get more information that you can initiate treatment from. Now, that's not to say that the comprehensive digestive stool analysis isn't important, because it is, because there's no way to really analyze for parasitic infections unless you're doing a comprehensive digestive stool test. And so putting together the CDSA or the OAT as a combined testing program even gives you that much more in-depth information. Well, some other common tests are food IgG testing. And the discussion of food IgG has been controversial because there has been testing in the past that really hasn't panned out to really be helpful for people. And really why is because most IgG testing is looking at something called IgG4, the antibody IgG4. And there's 4 different IgG antibodies, or what are called subclasses. It turns out that the IgG4 is actually more protective than anything else. It's not suggestive of a true food sensitivity. So Great Plains does total IgG, and they now have it as a finger prick test, and that's what I currently use. It's very accurate and very helpful. to analyze for food sensitivity. The urinary peptide test is something that's quite commonly done with individuals on the autism spectrum. You can use the food IgG and the urinary peptide test together to get a real nice assessment of gluten sensitivity and casein sensitivity. The urinary peptide test is picking up on these opiate-like compounds or these morphine-like structures that are found within gluten and casein that have a drug-like effect on certain individuals and kids on the spectrum. It can affect language and attention and focusing. And so many times we'll use the food IgG and the urinary peptide together. I often do the hair analysis. The hair analysis is easy to obtain, and it's accurate with respect to a screening test for heavy metal exposure. It does give some indication of certain minerals in the body as well. I wouldn't use it as a total mineral assessment, but it does a pretty good job at analyzing certain minerals. And so the hair analysis is something that I commonly do with a wide variety of people. And there's a few other things that kind of round out this general discussion of integrative medicine test. Amino acid analysis, that's not something I commonly do right up front with people, but it can be helpful in certain conditions we'll talk about shortly. It's to be given an idea of amino acid balance in the body or imbalances. What I do commonly in my practice with a wide variety of people is adrenal stress testing and looking at the output of cortisol, DHEA, and then sex hormone levels for individuals who are having hormonal imbalances. That's a very common test to be done in the world of functional medicine. So what are some test examples? Well, let's just touch real quickly on the organic acid test. I gave you kind of a brief overview of what the organic acid is useful for. But we look at a test sample here. You know, we have a yeast section, we have a bacterial section that, you know, can be cross-referenced to what's going on with somebody clinically. Oxalate are very important. Oxalates are commonly found with kids on the spectrum. It's also found in people who have a lot of physical pain, fibromyalgia, muscle pain, joint pain. Oxalates many times are quite high. We can use this test to assess certain neurotransmitter imbalances, look at mitochondrial function and how the body is producing cellular energy. That test is useful for that. And then there are other markers as well, looking at toxic indicators, vitamin indicators, and other types of amino acid imbalances. So overall, it's a nice comprehensive way of getting a snapshot of somebody's metabolism as well as specific markers for various toxins. Now, the yeast test, or the organic acid test, is most commonly known for its assessment of yeast. And particularly Candida, the Candida albicans, the most common form of Candida, and the toxins it produces. One of the reasons I comment, or one of the reasons I make the suggestion of doing the organic acid test over the stool test is many people try and do the stool test as a way to assess for Candida. And often the stool test misses the detection, not because the yeast isn't there in the digestive tract, it's just that it's embedded into the walls of the bowel and is not shedding to any significant degree anymore in the stool. But it's still causing a major problem chemically. You can pick up on yeast tests, or excuse me, you can pick up on Candida by doing the organic acid test, where it may not show up in the stool test. Clostridia bacteria is another area that you want to analyze for. Critically important because Clostridia is a nasty bacteria. There's a wide variety of these different family members in the Clostridia family. And it produces a number of different compounds, one of them called HPHPA, that can have toxic effects on neurochemistry in the brain, primarily leading to an excess of dopamine, and that can create oxidative stress in the body, lead to behavioral problems in extreme situations, aggressive behavior, self-injurious behavior, and in extreme situations in people who are susceptible, it has even been correlated to schizophrenia. One of the things that HPHPA is doing, or the Clostridia toxins, is they're altering this chemical called HVA, which is a biomarker of the breakdown of dopamine. And what happens is, if you look at things biochemically, when you have an increase of HPA, as we see here, let me grab my, well, I think you can see my screen. This chemical called 3,3-hydroxyphenyl 3-hydroxypropanoic acid, it will inhibit this converting enzyme called dopamine beta hydroxylase. There is another Clostridia bacteria that is specific to Clostridia difficile that also inhibits that enzyme. So as we block dopamine beta hydroxylase, we get a corresponding increase in dopamine with a spillover effect of an excess production of HVA, or also called homovanillic acid. Too much dopamine is neurotoxic because it's highly reactive to oxidative stress, and it can be overstimulating to the nervous system. So one of the reasons that I like doing the organic acid test in so many different types of conditions is because I want to analyze for Clostridia bacteria as well as yeast and other markers. The other thing about the organic acid test that I like, and I've learned how to correlate this more across a wide variety of disorders for patients, is its analysis of oxalates, or what's called oxalic acid. And oxalates are organic compounds that are found in many different types of foods, and healthy foods for that matter. But in some individuals, the oxalates become accumulative. In severe cases, they can lead to kidney stones, but they can also cause crystal accumulation throughout the body, in the joints, in the muscle tissue, connective tissue. Oxalates at extremely high levels can accumulate in the heart. They've even found them in the brain. And they can create mineral imbalances, and oxalates are also known to complex with certain heavy metals, like mercury. So oxalates are an important thing to analyze, not only with kids on the spectrum, but individuals with neurological disorders, and certainly in people with fibromyalgia. So the organic acid test has really multiple purposes here for a wide variety of individuals, from gastrointestinal problems to, again, fibromyalgia, to autism, to chronic fatigue, etc. Well, stool testing, as I mentioned before, is an important thing to have and to keep in mind as well, because again, there's no way to analyze specifically for parasitic infections without doing some stool testing to try and detect them as best as possible. One of the upsides of doing a stool test is being able to break down and get a better assessment of what kind of bacterial load we're dealing with, whether we're looking at an imbalance of beneficial flora, dysbiotic, which are potentially pathogenic flora, or just an imbalance of different bacteria. The stool test gives that kind of information. It also helps to break down and detect yeast. Now, again, many times stool tests come back negative for Candida, whereas the organic acid test can show positive reactivity, but sometimes we do pick up on yeast in the stool. And when you're able to detect yeast on a stool test, one of the benefits of that is being able to do what's called a yeast susceptibility. And so when they detect Candida or they detect a bacteria, the lab will do an analysis to figure out what agent, whether it's a prescription medication, as let's say a typical antifungal like nystatin, or in the case of a bacteria like an antibiotic, or they may use different herbal compounds to see what is effective at killing the organism. In this particular circumstance, if we're looking at bacteria, the S means that the agent is effective at killing the bacteria. The R means that the bacteria is resistant against that particular compound. Well, parasites are a fairly common problem, difficult sometimes to detect, but need to be analyzed in people who have ongoing digestive issues. And there's a wide variety of parasites. This particular sample is just looking at the detection of Giardia, which is actually fairly common in the United States. Matter of fact, about 7% of all stool tests submitted to hospital or regional clinics are contaminated with Giardia. Also, the comprehensive stool test analyzes for digestive function. In this particular example, we're looking at something called elastase, which is a pancreatic enzyme, and it basically is showing that the pancreas is not outputting digestive enzymes to an optimal level. And so in this particular circumstance, using digestive enzymes may be important. And we can certainly look at other factors too from a comprehensive stool test. The comprehensive stool analysis also has markers of inflammation. In this particular example, lysozyme is high. Lysozyme can be high in severe inflammation. Most commonly it's high because of bacterial or yeast overgrowth. Many times it correlates back to food sensitivity reactions. I tend to call it more of a surface level inflammation. It can be transient. It doesn't mean it's permanent. It doesn't indicate that it's an autoimmune disease per se. And oftentimes when you treat yeast or bacteria or up the probiotics or eradicate foods, the lysozyme goes away. On the flip side is the marker called lactoferrin. Lactoferrin is indicative of more deep-seated inflammation, and it has been correlated with more severe inflammatory bowel disease such as ulcerative colitis and Crohn's. Now, whereas lysozyme may be high in irritable bowel syndrome, lactoferrin is not elevated in irritable bowel. Lactoferrin is generally more elevated in more deep-seated inflammation, and in very high levels strongly correlates to inflammatory bowel disease. Now, it is possible to have elevations of lactoferrin, usually about this level or less. That can also be because of bacteria or parasites or food reactivity. So I wouldn't assume that every elevated lactoferrin is positive indication of an inflammatory bowel disease, but it definitely points in that direction the higher it gets. I do quite a bit of hair testing in my practice. I think hair testing is a great way to get a snapshot picture of heavy metal exposure. These are two different hair samples from some kids out of China and Hong Kong, where we see very high levels of arsenic, as well as things like mercury and lead. The nice thing about a hair test is it's generally easy to get. It's not invasive, and it's very accurate for the measurement of past heavy metal exposure. I will often incorporate a hair analysis if I'm doing it as a screening test, along with something called the porphyrin testing or porphyrin profile. Now, Great Plains carries a test called a porphyrin analysis. It's a urine test, and what porphyrins are this chemical chain reaction that occurs within the mitochondria of the cell, and the end result is it's producing a chemical called heme. Heme is what becomes hemoglobin in our cells to carry oxygen. Heme is also part of the P450 detoxification system in our liver. And it turns out that heme is also involved in helping to remove beta amyloids, which is something that is seen cumulative in individuals with Alzheimer's. Porphyrins are very sensitive to environmental toxicity, not only chemical toxicity, but especially heavy metal toxicity, mercury, lead, arsenic, etc. There are genetic defects in porphyrin metabolism, which are quite rare, and when they are positive, many of them are life-threatening, but they're extremely rare. So the porphyrin test is a way, along with a hair analysis, to look at the exposure of heavy metals as well as get an idea of cellular reactivity to heavy metals. Now, sometimes you'll get a porphyrin test that will come back that is normal, but the hair test shows high levels. And I often tell people that a normal porphyrin test doesn't mean there couldn't be heavy metals in the body, and doesn't necessarily mean that you wouldn't pursue some type of heavy metal detox intervention. It just really indicates that the porphyrin system that's sitting within the mitochondria is not being affected, which is a good thing. So the porphyrin test certainly has a place in heavy metal assessment. So all of these factors can lead to what we call chronic stress. And whether it's hormonal imbalances, immune system problems, metabolic breakdowns from a wide variety of things, from toxic food to toxic environment to toxic emotions or life stress. And essentially what's happening is these things lead to an increase of a particular chemical called ACTH. And what ACTH does is it causes a chronic stimulation in the brain that tells the adrenal glands that we need to be outputting more stress hormones. When we have chronic stress and the hormone balance in the body starts to tip more towards the direction of producing more and more cortisol, and that's what this slide is showing here, as these hormones pass through this system, the red arrows indicate the preferential pathway under stress. And so the body is really working to prioritize to maintain cortisol output to help control inflammation, to help control blood sugar, to help control protein metabolism, to help control cellular function of DNA. The list goes on and on and on. When we are under chronic stress, we put a tremendous demand on our hormone system as well as our adrenal system. And that can lead to wide sweeping effects on overall health. This particular slide, called the chronic stress response, is important because it really shows that stressors, no matter what they are, whether it's mental, emotional, physical, deprivation of sleep, traumatic, surgery, trauma, inflammation, environmental, food, exposures, yeast, bacteria, whatever it is, the feedback that it gives to the brain and the output of this chemical called ACTH is the same. And it can be cumulative. It doesn't have to be one thing. It could be 20 things that are doing it. And the chronic stimulation of the adrenals, the output of cortisol over time, causes a blunting effect in the brain where things start to shut down. And we start to run a whole host of problems here with our blood sugar, leading to diabetes and heart disease, the breakdown of bone with osteoporosis, the accumulation of fat, the breakdown of protein, high blood pressure, and then the destruction of the immune system over time, which can just lead to a host of problems, whether it's cancer, autoimmune disorders, yeast overgrowth, bacterial overgrowth, you name it. And so understanding the relationship of the adrenal glands within the broader discussion of integrative medicine and functional medicine testing is critically important for a wide variety of individuals with chronic health issues, because it's the balance of the adrenals that control and help balance the nervous system, help control the bone and musculature, help control glucose metabolism, inflammation. Even detoxification is affected by that, and certainly endocrine function. And so one of the other tests that are commonly on the list of things to do with individuals with chronic health issues or just chronic health complaints is functional adrenal stress profile testing. And what we're doing in this type of testing is looking at individual levels of cortisol and matching that with DHEA, because DHEA is another hormone that comes from the adrenal glands. The DHEA is what helps to feed testosterone and estrogen. Progesterone is what helps to feed cortisol. And so when we have a skewed effect where the body is under stress, putting greater and greater demands for normal cortisol output, we can start to run deficits or imbalances in other sex hormones. Progesterone can become imbalanced. Testosterone and estrogen can become imbalanced. In fact, very severe adrenal fatigue can actually lead to early menopause in women. So the ability to do salivary testing for hormones is critical and an important piece of the overall functional medicine picture with respects to testing. Well, the story doesn't end there, because if there is adrenal dysfunction that is being caused by a host of different chronic stressors, then that adrenal dysfunction over time can also alter thyroid function. And this is unfortunately, this is a concept that's not well understood in traditional medicine. I mean, you're not taught this in medical school, but a lot of times low thyroid, which certainly has its own list of problems, often mimics or looks very similar to low adrenal symptoms. And many times people assume that it's low thyroid where it's low adrenal or vice versa. Most functional medicine doctors, and I'm using these terms interchangeably, functional medicine, integrative medicine, biomedical intervention, essentially we're all integrative medical practitioners. They understand the importance of adrenal testing, and they understand the importance of thyroid, but a lot of traditional doctors don't. And what they don't understand is that the adrenals can turn the thyroid off or at least slow it down. Let me show you a couple areas where that can happen. And here's where we're looking at adrenal function, right? We have the hypothalamus, which sits within the brain. The hypothalamus is receiving information from the body or mental emotionally. It's inputting into the hypothalamus, and it's telling the hypothalamus to release this chemical called CRH, cortical-releasing hormone. That CRH chemical goes down and tells our pituitary, hey, we need more ACTH, adrenal corticothyrotropic hormone, and what it's doing is the ACTH is flowing down to our adrenals and telling the adrenal glands, hey, we need more cortisol. Well, in a normal situation, that system is balanced, the stressor's turned off, and everybody's happy. But in chronic stress, we get increased CRH, increased ACTH, and increased cortisol over time. Now, it turns out that CRH can actually inhibit the chemical called thyroid stimulating hormone, which the pituitary is also producing to tell the thyroid to make more thyroid hormone. So TSH is inhibited because of chronic stress. Also, cortisol itself can inhibit the conversion of T4 to T3. T3 is the active form. That's what's used at the cellular level. And so often we'll get a we'll get a blending effect of T4 and sometimes get an increased production of reverse T3. I had a patient recently who had, essentially they had a low normal T4, a low T3, and a low TSH. Okay, and so what this was telling me was that the adrenals were very likely shunting off or turning off the TSH production. He was kicking out enough T4 to at least have somewhat of a normal value, but it wasn't being converted to the active T3, and the cortisol is likely shutting that down. Okay, so one of the problems in the relationship between thyroid and adrenal is people just assuming it's thyroid and just throwing in a bunch of thyroid hormone when they haven't worked on the adrenal glands and the adrenal system. So part of this discussion of more comprehensive testing is to do more comprehensive thyroid testing. Most doctors will do just what's called a TSH, a thyroid stimulating hormone. However, if you come back here and they come back and say, oh, your TSH is normal, that tells you nothing. I mean, the TSH could be low normal and they could read it as normal, but if you're not looking at the more physiological forms of these thyroid hormones, you're not getting an accurate picture. You need to get a free T4 and a free T3 because these are the physiologic or what's called the unbound form of thyroid. Okay, so free is physiologically active. Now, you can incorporate a reverse T3 into that equation, and I do sometimes. I don't always do that, but I will sometimes run a reverse T3. And then if there's a strong suspicion that there may be an autoimmune thyroid condition, or this could be done at a later time, is doing what's called an anti-TPO and thyroglobulin antibodies to see if it's the immune system that's attacking the thyroid. but minimally a TSH, free T4, and a free T3 should be done. All right, so let's shift gears here and talk about certain disorders. And, I'm just going to touch briefly on these. I mean, I've done, a lot of talks on autism, and you can cross-reference those back to the webinar library from Great Plains. Now, this is also going to include those individuals with attention deficit, hyperactivity, and sensory processing issues. So what are some first-line tests that I will commonly look at with individuals on the spectrum? I always like doing an OAT, I like doing a hair, and I like doing a food IgG. Now, would I do more? Certainly. But if we're going to have an entry point here for most families and most kids, this is not a bad place to start. We get good assessment of metabolic function, yeast, Clostridia. I get a snapshot picture of heavy metals, and I get an idea of what kind of food sensitivities we're looking at. Plus, none of this requires a blood draw. The food IgG is a finger prick test. Now, that doesn't mean we can't add on some testing. Okay, so if we've got a lot of digestive problems, we might go ahead with a comprehensive digestive stool analysis. If I'm going to do a hair and it's affordable, I like to do the hair and the porphyrin together. Urinary peptides can be added, and you can think about the urinary peptides linking up with the food IgG, particularly in a child that's not on a gluten casein-free diet, or a parent who wants to cross-check and make sure that the diet that they are doing is clean. The urinary peptide can be helpful for that. And then there's a host of other things to look at. Vitamin D levels are important. This too can be done through a finger prick test from Great Plains. The advanced cholesterol panel is a blood test, so I would tend to hold this until we get to the point of doing blood testing. When I do blood testing, I like to do enough blood testing to make a difference for a lot of the stress and struggle that it takes to get a kid to do blood testing. And so we may look into doing more things, looking at thyroid, looking at immune function, looking at liver function, kidney function, etc. And that's where we'd look at cholesterol and vitamin D as well. And then maybe an add-on test, typically not something I do right off the bat, would be amino acid testing, but that also is something that's applicable. I typically wait on this because oftentimes if amino acids are imbalanced, it often leads back to some type of digestive problem, bacterial issues, inflammation, food sensitivities. So instead of just dumping in a bunch of amino acids right away, I want to make sure that there's not some type of chronic infection that's going on that needs to be cleared first. So what about attention deficit hyperactivity, sensory processing disorders? Some of these things certainly could be thrown into the category of autism spectrum, but let's just separate it out for discussion purposes here. Well, in reality, much the same thing. The oat, the hair, the food IgG would certainly be appropriate in this particular circumstance. And in actuality, it really tends to mirror image what I would do with kids with a confirmed diagnosis. I mean, I don't really approach these types of situations any way differently. Of course, for me, as a practicing clinician, I'm always going to get a clinical intake, and I may pick and choose a few other things here based on my clinical suspicion. But as just a frontline entry point for most kids, the oat, the hair, and the food IgG is not a bad place to start. Okay? Well, what about mental health disorders? I mean, we could have an entire talk just on depression or just on anxiety. What are some first-line tests that could be incorporated with these people? Well, again, I think in these particular circumstances, just like with kids on the spectrum, oat, hair, and food IgG should be done on everybody because there's a lot of data out there that shows that chronic infections, heavy metals, and food sensitivity are a problem across the board for individuals with depression, anxiety, bipolar, or schizophrenia. What about some add-ons? Kind of comes down to a similar list, and really based on clinical suspicion. One of the things that I'm highlighting here in red, and that is if I was going to do some add-ons, I would in these types of situations, depression, anxiety, etc., If I was going to have add-on or second-level testing at a later time, I would prioritize to the red. I would look at vitamin D. I would absolutely look at cholesterol levels and comprehensive metabolic testing. In most of these people, we're looking at adults, so blood testing is not as problematic as in young kids. But even in kids who are having these problems, the blood testing does become essential. So if you were looking to start with a comprehensive panel, then I would use the ones here in red: oat, hair, food, vitamin D, cholesterol, and doing a comprehensive metabolic panel, and particularly paying attention to that thyroid assessment, the TSH, the free T4, and the free T3. Now, what about some additional tests for mental health disorders? And again, depression, anxiety, schizophrenia, bipolar. That's where I look to start incorporating the functional adrenal stress profile and starting to look at cortisol and looking at sex hormones in more adults. And again, why is that important? Well, it turns out that cortisol is very important to control inflammation. It has a regulating effect over brain function and hormone output. And this is another piece of the puzzle that needs to be done for people with a wide variety of mental health problems, because often they either have excess cortisol, or if it's a long-standing issue, very low cortisol. I do some testing and adrenal testing with kids on the spectrum. It's certainly not inappropriate to do that. It's just that in some kids it's difficult to do the saliva testing. They either can't, they can't spit into the tube, they can't get enough saliva collection, so it can be a little bit problematic. But if it's not, then it's useful, another useful test for those kids too, because the reality is they have a lot of chronic stress. And oftentimes we find when we do get the tests that they tend to have adrenal exhaustion too. Well, again, kind of coming back to this discussion about the mental health disorders, we have to recognize that thyroid plays a big role in this as well. And if our adrenals are imbalanced, then very likely the thyroid is going to be imbalanced too. So just to reiterate, TSH, free T4, and free T3 are very important in patients with mental health disorders. Okay, and then there's a few other things that may be appropriate, probably not up front for reasons I've stated before. If you've got chronic infections, chronic digestive problems, that's not a situation where I would immediately start adding in amino acids. But amino acid analysis and looking at amino acids from the essential amino acids, non-essential amino acids, do play an important role in brain chemistry. One of the nice things about the organic acid test is there is a way to assess for neurochemistry or neurotransmitters. You can look at HBA levels, which link to dopamine. You can look at VMA, which links to norepinephrine and epinephrine. You can look at a chemical called 5-HIAA, which links to serotonin metabolism. So I personally don't get into the neurotransmitter testing, and I'm not bashing that testing at all. I just haven't found it to be clinically applicable for what I do. Some people find it is. I generally rely on the information off the organic acid test, but that's another option and another way of looking at things. I typically wouldn't do that kind of testing right up front for most people, only because I want to find out if they've got chronic infections and food sensitivities that need to be cleared away first. That's my preference. And then essential fatty acid analysis, this could certainly be appropriate for people with more real severe mental health disorders if they're not getting improvement through some of the intervention that's being done based on the other testing. It's probably not an area where I would start going right away. I would tend to look at the other markers or the other tests that I had indicated prior. But again, these are just some additional considerations. And then in some cases, if things are not resolving, whether it is with kids on the spectrum, ADD, ADHD, depression, anxiety, bipolar, mental health disorders in general, then this is where you may need to go and start looking for other types of infections. And this sort of brings us into that other category of immune system testing, looking at chronic viral infections, something called nagalase testing, which is done quite a bit with kids on the autism spectrum. And I'm not saying I don't do nagalase testing, I do, but what I have recognized now over the past year or so is on average, on average, all the kids for the most part have a nagalase level about 1.20, and they have a range between 1.1 to 1.80, and average between 1.2 to 1.3. And I've gotten to the point I can almost not do the test and realize that's what the marker is going to be. And I'm not saying don't do the test, but pretty convinced anymore that it's going to show up around a 1.2 to 1.3. What I'm not going to touch on tonight, because it's such a huge topic and it's a new test that is now being incorporated into Great Plains menu, is the DNA methylation testing. This is the nutrigenomic testing that is very similar to the test that Dr. Amy Yasko has been providing for years. It's a wonderful test, I think. It provides a lot of information. It can be very helpful not only to understand more about the metabolic enzymes that are involved in methylation and other neurochemical processing with kids on the autism spectrum, as well as people with mental health disorders. It's a very intense study. And the markers are important, but you really, as an individual doing that test or as a doctor doing that test, it takes a lot of intense work to understand what those markers mean, how to supplement for them, and how to integrate that into your program. So this will be left for future discussions, because this is going to be something that more and more people are doing, and it's very, very worthwhile. But again, it's sort of it's another level, a layer of intensity that isn't always necessary to do when you're first starting to do testing. All right, so let's shift gear and talk about some specific disease conditions. Rheumatoid arthritis is actually a fairly common diagnosis. There's a lot of people who are diagnosed with rheumatoid arthritis, and it's a disabling and crippling disease. And there's many different types of factors that trigger it. Many people with RA often have it triggered because of a stressful event. There can be chronic infections that are associated with it. Food reactions often are linked to rheumatoid arthritis, either in causation or a contributing factor to the problems. We know that intestinal infections have been linked to it, and there's some evidence with respects to toxic heavy metal accumulation as well. So some of the standard blood testing that I think that everybody with rheumatoid arthritis should have done: thyroid testing, B12 and iron levels, looking at hormone deficiencies, and then certainly looking at immune dysfunction and markers of autoimmunity. Now, most of the time, people who've been diagnosed with RA will have had some of these tests done. The rheumatologist may have run RA factors or ANAs or SED rates, so that kind of stuff is done already. They're often not tested for the thyroid by using the free T3, the free T4, or the TSH. So when it comes to rheumatoid arthritis, like a lot of these autoimmune disorders, it's not just doing a few tests, it's taking a very comprehensive viewpoint to see what are some of the puzzle pieces that are causing this individual's problem. So some first-line testing, again, standard blood test, thyroid, and I like to look at vitamin D because of its relationship to the immune system and improvements in autoimmune disorders. And again, the organic acid test. There's evidence out there that shows that Clostridia can be a cross-reacting bacteria. Certainly all the other metabolic factors and yeast can certainly worsen the situation. I like to do a stool test. Is there some type of parasitic infection that may be stressing the body? What's the digestion look like? If we have faulty digestion, then we're going to have an accumulation of abnormal proteins, which can be pro-inflammatory. Food IgG testing is critical for people with rheumatoid arthritis because it's the adverse reactions to foods that can cause increase in inflammation and tissue swelling. And then I also like to do the functional adrenal stress profile to analyze cortisol levels and also to look at the sex hormone levels if possible in adults. And then some add-on or second-tiered testing with some individuals. Lyme testing may be appropriate, hair analysis certainly may be appropriate if you have a strong suspicion that heavy metals might be a problem here. Well, what about other autoimmune disorders? Mixed connective tissue, psoriasis, lupus. Well, same kind of stuff, right? I mean, just like the autism and the ADD hyperactivity, we have a very similar list. And in reality, I can't think of anything different that I would do for an individual with one of these other autoimmune disorders that I wouldn't do for somebody with rheumatoid arthritis. Well, let's talk about multiple sclerosis. Again, another serious disorder, and we can link that to other types of neurodegenerative diseases. These are tests that I feel are first line that everybody who has a diagnosis with multiple sclerosis should do. Standard blood test, just like before, looking at thyroid, liver function, lipid levels, etc. I want to get a much better assessment on thyroid function. Matter of fact, I've seen a fair amount of people with MS who have low thyroid and actually feel better when you get their thyroid regulated more appropriately. Vitamin D is very important in MS. It's often low, and vitamin D therapy is an important therapy for people with MS. Organic acid testing. Many people with MS tend to have a poor metabolism as far as their energy production. They have a lot of fatigue. There's heat intolerance problems, and we want to make sure that there's not some type of chronic infection and look at mitochondrial function. Food sensitivity, again, is another cross-reacting problem with the immune system that can be a big irritant to people with MS. Hair analysis, there's some interesting information about imbalances in minerals and heavy metals with respect to MS. And then again, I'm going to look at things like the functional adrenal stress profile, as well as doing a comprehensive digestive stool analysis in people to see if there's some type of chronic infection. Just like we do with the kids on the spectrum, trying to figure out what puzzle piece may be fitting their autism puzzle, going through a differential diagnosis of things that can cause imbalances in the body. The same types of things apply to these other types of disease conditions. It's just manifesting differently in these types of people. Well, what about other types of neurodegenerative diseases, whether that's Alzheimer's, dementia, ALS, what's called Lou Gehrig's disease, etc. Again, I can't think of anything really differently that I would do for these types of individuals that I wouldn't do for somebody with MS. You have to start going through your diagnostic criteria to see where the problems are. One of the things about lab testing that I talk to a lot of doctors about is, nobody wants to spend money on labs. And, there's a lot of expectation that labs, because they are expensive, some of them, are going to show some type of positive result. And, it's great when you get a lab back that actually has a positive marker and you say, hey, this is positive, and you treat an infection and things improve. But sometimes negative lab tests are just as important because it allows you to cross things off your list as possibilities. You can go through your checklist and say, well, we don't need to deal with that problem, or this doesn't appear to be an issue. And that's not a bad thing either. So testing is important because it helps to rule things out and helps to rule things in. Well, what about chronic fatigue and fibromyalgia? And this would really include also the chronic fatigue immune deficiency syndrome. So what are some first-line things that you can think about, whether this is something you're dealing with yourself or if you're a practitioner with some patients. So first-line testing, again, standard blood test, thyroid panel, organic acid test, food IgG, and really the cornerstone for people with chronic fatigue would be the functional adrenal stress profile. I really think actually that linking the organic acid test and the functional adrenal stress profile is critically important. And I see a lot of practitioners who understand the functional adrenal stress profile, but they don't understand the OAT. And they're missing a big piece of the puzzle and not doing both. And I really, that's going to be a goal of mine in the months and years to come, is to try to spread the word that these two things are critically important to do and not forget about them, because there's so much going on in those two different types of tests. Well, what about some add-ons? Hair analysis, important. Heavy metals certainly can be a problem for people with chronic fatigue. Looking at digestive function more in depth for other types of chronic infections. And then, of course, sometimes you have to get into more immune deficiency testing with people with chronic fatigue, particularly things like viral infections and whatnot that may be going on. For a lot of people who have just low-level fatigue, they don't feel their best, they have poor sleep, they're able to function through the day, but they're just not, they don't have the zest to life that they once had. There's absolutely nothing wrong with starting with these 4 tests here, because they may be fatigued, but they don't necessarily meet the definition of chronic fatigue. They just are drained. They're adrenally exhausted, adrenally stressed, but they're not manifesting with severe immune deficiency or chronic neurological infections. So this is, I think, really the priority: thyroid, OAT, food IgG, and the adrenal stress profile. Well, what about fibromyalgia? And these are some things that I really feel should be done on everyone who has this particular problem. And again, it comes back to the same types of things that you would be testing for in people with chronic fatigue. Food IgG. In this particular circumstance, I would definitely do a stool test, because you want to see if there's any type of parasitic infection or major bacterial infection. The organic acid test is really important, in particularly people with fibromyalgia, because of the oxalate levels. Oxalates are a known factor in fibromyalgia. It's not the only thing, but that needs to be looked at. And then, of course, a functional adrenal stress profile. In some cases with fibromyalgia, I may look at amino acids if we can take care, or if there are gut infections, and that has to do with the amino acid balance in the brain, and these oftentimes working on amino acids can be helpful for people with fibromyalgia. Well, what about inflammatory bowel disease, Crohn's disease, ulcerative colitis? These are must-do tests that I think are important. Got to do a comprehensive digestive stool analysis, primarily looking for infections, parasitic, bacterial, and you can also get an idea of digestive function too. We already know there's inflammation, so you would expect that the lactoferrin and possibly the lysozyme is high. The organic acid test makes perfect sense. Again, chronic infections, oxalate issues, mitochondrial problems that could just be weakening an individual's ability to function throughout the day. Food IgG, that's a no-brainer to me. We got to make sure that there's not some type of food sensitivity that could either be, causing or at least contributing or worsening the situation with one of these inflammatory bowel problems. So let's touch on some miscellaneous complaints. And there's a short list that I have here. What are some things that we can think about with heartburn or reflux? I would definitely do the organic acid test. I would also do the comprehensive stool, ruling out Helicobacter pylori. H. pylori is a bacteria that embeds itself into the lining of the stomach. Over time, it starts to create a problem where it creates a dysfunction in hydrochloric acid production, protein digestion, and can lead to reflux and heartburn. it can be a real problem. So we want to look at that as well as some other infections. And then food IgG. I mean, that's real important too. Is there some type of problem here in food reactions? If we come back to the oat, many times chronic yeast, a yeast infection can actually increase food IgG reactivity that can lead to heartburn too. Muscle pain and discomfort. In reality, you could pretty much do the same kind of test for this scenario that you might do for somebody with fibromyalgia. Oat testing, food IgG stool. I threw in here urine essential elements. I know I hadn't talked about this. This is not a bad way of just looking at mineral levels if you're trying to avoid a blood test. And you can get an idea if somebody's not on minerals, if they are just spilling a lot of minerals or their mineral levels are overall. That many times, particularly things like magnesium and whatnot, can be a contributing factor to a lot of muscle pain and cramping. So would I automatically do this? Probably not. I might look at these other factors, get somebody started on some supplementation, make sure their diet is balanced, give them some mineral supplementation, and most of the time that's the fix. So I wouldn't necessarily automatically add urine essential elements unless we were just not getting resolution any other way. Poor sleep. I mean, there's many factors to poor sleep, but from a testing standpoint, again, the organic acid test is useful. Food IgG, sometimes food reactions at night can be a trigger for poor sleep. They certainly could be a trigger for reflux, which could cause poor sleep. Functional adrenal stress profile testing is important. Many people with adrenal exhaustion tend to get a second wind at night where their cortisol levels are high. And when cortisol levels are high at night, that can inhibit the brain from turning off. And so that's important because there's some things you can do to help lower nighttime cortisol. And then if we're not getting resolution here, amino acid testing to see if there's any type of amino acid imbalance that could be creating a problem chemically with respect to poor sleep. But I think initially I would look to do the oat, food IgG, and functional adrenal stress profile. Digestion, bloating, digestive issues, bloating, constipation, etc. Straight up organic acid, yeast, bacteria, oxalates, comprehensive stool, chronic infections, food IgG. I mean, that really tops the list for that particular category. Skin problems and rashes kind of comes back. Food IgG is really high on the list. A lot of people with these sort of obscure skin reactions, it's not dermatitis, it's not eczema, not sure what it is. Many times it's linked to some type of adverse food reaction. Sometimes it could be a bacterial or yeast problem. Sometimes it could be a chronic infection in the digestive system. And then sometimes you have to do additional testing. I've seen some people with low thyroid who tend to be more reactive. Certainly may not be food. It could be environmental allergens. And so doing an IgE, environmental allergy panel. Great Plains actually has the inhalant panel, which looks at environmental factors. That could be a reason for ongoing skin and rash problems. And I would say one thing here about skin rash problems, if it's not resolving, make sure you see a dermatologist, because there are more people out there who actually have psoriasis than they know about it. It's just not full-blown psoriasis. And then if that's the case, you need to start doing more in-depth testing with respects to autoimmune problems, kind of similar to what I had mentioned before. And then functional adrenal stress profile testing as well. Poor exercise recovery is something that I have seen quite a bit, whether it's in athletes, people who are just sort of overcoming a real stressful problem, where they exercise but they just don't fully rebound. They either feel a lot of joint pain, fatigue, they just can't get their energy going again. In these particular circumstances, the functional adrenal stress profile is an absolute must. And then I'll also look at food sensitivities because of the ability, or I should say the tendency of these foods to trigger inflammation. I may incorporate some essential amino acids, and I may incorporate elements, and may incorporate amino acid testing as well, see if there's some really serious nutrient depletion. Most of the time in this kind of situation, I'm starting with adrenal testing, looking at food reactions, and then starting some people on some quality supplementation to try to resupply some of those nutrients. And if we're not getting good recovery, that's where I'd start to look a little bit deeper. And then finally, hormone imbalance, low sex drive. I mean, from a functional medicine standpoint, this is what requires, the quintessential test in functional medicine, and that's the functional adrenal stress profile with sex hormones. Looking at estrogen, looking at progesterone, looking at testosterone, looking at cortisol levels throughout the day, looking at DHEA, and getting an idea of where the deficits are. What people need to understand is that you can run deficits in sex hormones because of long-standing adrenal exhaustion. It's the adrenals that help with the pacing of ovarian function. And when the adrenals are stressed, then the rest of these hormones can become stressed too. And the fix isn't always just throwing hormones at people. It's working on adrenal function and then linking that back to lifestyle factors, to dietary factors, and to other chronic stresses, whether that's chronic infections, chronic food reactions, heavy metals, etc. And then in these types of situations, it certainly makes sense to do some further assessment, blood testing, looking at thyroid, looking at food reactions, looking at organic acid testing to see what other kinds of chronic stressors may be going on here that's causing a problem in the adrenals. Okay, so that rounds out the discussion here on lab testing for a wide variety of issues. And I'm sure there's a lot of other health disorders out there, but I think you kind of get the point that a lot of stuff that we're talking about, a lot of the testing is fairly similar. And you can start with a few things to get the ball rolling and start to add other testing at a later time. And this is something I've done in my practice for many years. I talk with doctors throughout the country and doing the same types of things, and then helping patients as well, figuring out and prioritizing which test may be most appropriate for their particular circumstance. I wanted to make you aware of a service that we provide now called Lab Test Plus. And this is a website where general public can have access to certain integrative medicine testing. Things like the organic acid test from Great Plains, or a comprehensive stool test, access to salivary adrenal testing, hair testing, amino acid testing, etc. And through this website, there's a menu that you can look at, and you can see what it is that you're interested in, and order these tests. The test kits are sent directly to your home or office, and when we get the test results back, I provide an in-depth written interpretation of many of the tests, like the organic acid or the hair testing, amino acid testing, and my partner, who is a specialist in women's health and hormones, will also provide information on adrenal testing as well. And so you not only get the tests, but you also get written interpretations of what the tests mean, along with action steps, meaning recommendations, whether it's for supplements or dietary recommendations and whatnot, based on those test results. So it's a great service, and it's something that is available now at labtestplus.com. You can go to that website and look for the complete list of labs that are available. One of the other things about Lab Test Plus that I want to make you aware of is if you have questions about testing, you're not sure. Maybe perhaps you say, well, I know I kind of want to do a test, and I'm not sure. There's maybe some things I want to look at. You can submit your questions to us, and we can help guide that process. We can sort of give some general suggestions based on our experience working with other people, which lab tests may be most important for you to look at. So you can go to labtestplus.com, go under the Which Test section, and there's a little link. You have to read, there's a paragraph, read the link, and you can submit your question there. Now, I'm available for consultations. If you're new to these webinars, I work a lot with families around the country and around the world with kids on the autism spectrum. I've also worked with people with MS, other autoimmune disorders. I do a lot of consulting with doctors on functional medicine, adrenal testing, thyroid dysfunction, and my partner works a lot with women and women health issues, as well as individuals having chronic fatigue, adrenal exhaustion, etc., and detoxification. So if you want more information about us in general, you can go to mysunrisecenter.com. If you are a parent of a child on the autism spectrum, I'm available throughout the day, in the evenings, weekends, through autismactionplan.com, which is a subscription website that is just paid month to month. There's no long-term contracts. There's a parent forum where you can post questions to me, and I'll answer questions that I can through that forum. This is the service that's been up for many, many years, and I can provide feedback on supplements or troubleshoot some ideas for you, or if there's something you want me to look at that you want to link to me, that's fine. You can do it through the parent forum as well. So that service is available too. And then, of course, if you want to just get more general information about me, you can go to drwohler.com, and there's my phone number for consultations and email. And I do in-person consults as well as phone and Skype consults for people throughout the U.S. and worldwide. So with that, I hope this information was helpful for you. If you did submit a question through this webinar service, those questions will be sent to me by Great Plains. Because we go through so much information and these are recorded, I don't do a question and answer after these, but the questions you did submit will be sent to me by Great Plains. I'll answer those back. Usually those come filtering through in a couple days after these recordings. And then, of course, this presentation was recorded and will be posted on Great Plains' website here shortly. So with that, everybody, I hope you had I hope this was helpful for you. I always enjoy doing these webinars, and we'll see you again next time. Thanks so much.